Come in. Hello.
I'm Monica. I'll be your nurse today. Do you mind giving me your name and your date of birth?
Henry Dawson, 11/09/1998.
11/9/1998, Henry Dawson. Okay, we introduce ourselves, we verify our patient, we wash our hands, provide privacy. Mr. Dawson just came up from the emergency room, came in for back pain. Sir, how did you hurt your back?
Football.
You was playing football?
Yes, ma'am.
Okay. On a scale of 0 to 10, what will you rate your pain?
About a 4 or 5.
About a 4?
Yeah.
Is it your lower back?
Yeah, my lower back.
Lower back, okay. Have you taken any medications at home?
No, ma'am.
You haven't taken anything for any relief?
No, ma'am.
Okay, you just came to the emergency room.
Yes, ma'am.
Okay, you're not addicted to any pain medication, are you, sir?
No, ma'am.
Okay. All right, well, while you're here, I'm going to go ahead and do a full assessment so the doctor will know more about you when you come in, okay?
Okay.
Have you ever had any history of any falls?
No, ma'am.
No falls?
No, ma'am.
Are you able to tell me what year it is?
2021.
2021?
Yes, ma'am.
Do you know where you're at right now?
The health department?
You're at the health department?
Yes, ma'am.
Okay. All right. I'm gonna first check your head area. Did you hit your head or anything when you fell?
I think so. Maybe. It's a possibility.
Okay. I don't feel any knots, any hematomas. I don't see any open areas, anything. Do you have any history of any headaches?
No, ma'am.
No headache? Is your head bothering you right now?
No, ma'am.
Okay, that's good. We'll also check the patient's ears. We can do the whispering test. Make sure the patient can hear well. Do you wear hearing aids or anything?
No, ma'am.
No hearing aids?
No, ma'am.
All right, the ears look symmetrical. Your eyes. Do you wear contacts?
No, ma'am, I don't.
No visual problems?
No, ma'am.
We'll assess the patient's pupils. Make sure they're equal, round, and reactive to lights. Let's follow my finger, okay?
Okay.
We'll check for dilation as we move closer and constriction. That's accommodation. We'll also check the nasal cavities. Do you have any allergies, any sinus?
No, ma'am.
You're not draining anything?
No, ma'am.
All right. No seasonal allergies?
Sometimes.
Sometimes. Do you take any over-the-counter medication?
No, ma'am.
Okay. We'll also check the mouth. Check for any cavities, any missing teeth. The mouth is moist. Look like he's well taken care of. We'll also check his trachea. Do you have any difficulty swallowing?
No, ma'am.
No difficulty swallowing?
No, ma'am.
We'll make sure that it's symmetrical. Swallow for me, please. Okay, the patient swallowed fine. Also, while you're here, I'm going to get you to turn your head that way. We'll check for the jugular vein. No distension. And we'll also check both sides. Check for any distension in the jugular vein distension, okay?
Okay.
All right. Let's also check your limbs. For any edema, we'll start at the hand and go up. We'll check your nail beds for capillary refills, which is less than 3, and they're blanching good. Circulation is good. Your skin, check the skin sugar. Make sure it's elastic. You're not at risk for any dehydration. While I'm here, we're going to check your pulse, your radial pulse, and we'll check those bilaterally. And they both appear to be a 2+, the brachial, and then we have the axillary. All right. And while I'm in this area, I'm going to go ahead and listen to your lungs. Do you have any respiratory problems, any asthma, bronchitis,
No, ma'am.
COPD?
No, ma'am.
Do you smoke?
No, ma'am.
Are you sure, sir?
Yes, ma'am.
Okay. All right. If you'll take a deep breath for me, okay?
Okay.
Breathe normally, please.
Okay.
And remember, over here on the left side, there's only 2 lobes. You listen to the 4 anterior sides And we'll also listen laterally. Your lung sounds clear. No shortness of breath or anything?
No, ma'am.
Even when you get up and move around, you don't have any shortness of breath?
No, ma'am.
Okay, while I'm in this area, I'm going to go ahead and listen to your heart as well, okay?
Okay.
And we'll start here at the pulmonic area. And it's right here at the second intercostal. And we'll move over to the left side of the sternum. We'll go down to the Erb's point, which is at the third. And then we have the tricuspid and the mitral, which is at the apex of the heart. I'm also going to listen to your stomach to check for bowel sounds. And we normally start in the right lower quadrant because that's where bowel sounds are most always active. My patient's stomach is soft. It's not distended. Sir, is your appetite good?
Yes, ma'am.
When the last time you had a bowel movement?
Probably an hour ago.
An hour ago?
Yes, ma'am.
Did you spray some?
Yes.
My patient's bowel sounds are active. Do you have a good appetite?
Yes, ma'am.
Your stool, was it normal? Was it liquid-like or was it formed? Was it normal for you?
It was regular.
Do you have a bowel movement every day?
Yes, ma'am.
Okay. Good. So the patient has active bowel sounds. Abdomen is normal. They're active in all quads. My patient, his speech is clear. Also, let's see. We're going to check now for the lower extremities.
Okay.
And also at the same time, I would listen posterior. I would listen to the four anteriors and laterally as well for the long sound. He sound clear. And we're going to listen to the back side, the posterior side, and those lungs are clear as well. We're also going down to the lower extremities. And we'll check his lower extremities for edema. We'll check for the posterior. What is it? Posterior dorsalis pedis. Dorsalis pedis, which is on the top of the foot. Both pulps, we'll check those bilaterally. We'll check the posterior tibia. And those are both 2+. And we'll also check for any edema, any pitting edema, if there's any indentions in the skin. We'll check lower, and we'll come up higher to his leg area and check for any edema, which he doesn't have any edema. We'll also assess the bottom of the patient's heel of their feet to check to make sure that there's no open wounds. Sometimes older patients tend to get wounds on the bottom of their feet, and they have protectors to keep them. And you'll check those bilaterally. Make sure you check for any wounds. So do you have any open areas, any skin tears, abrasions?
No, ma'am.
Any sores on your body?
No, ma'am.
All right. Patient doesn't have any wounds. Skin is intact. While I'm here, I'm also going to check your range of motion, okay, for your lower extremities. Are you able to stretch your leg out, extend your leg for me? All right. Let it down. Flex it back. All right, extend. Let's check the strength. Extend it. All right, he has good. And let it back down. Let's see. Let it back down. Whoa. He's pretty strong. He has full range of motions, and we'll check those bilaterally. Let's see. Let's check here. Let's see. Extend. Flex. All right, extend it again for me. Then flex. Flex it. My son is strong. So he has full range of motions. We'll check those both bilaterally. Now I would like for you to, are you able to stand?
Yes, ma'am.
Do you use any type of assistant device? A cane, walker, wheelchair, anything?
No, ma'am.
No history of any falls?
No, ma'am.
All right, let's check your gait to see if you're steady. Sometimes you do have patients that are unsteady, and you want to stand by in case you need to assist. All right, let's see. I'm gonna get you to make a couple of steps forward, okay? All right, and we'll go back. My patient's gait is steady. His balance is steady. We'll also teach, you can have a seat, sir. We'll also teach our patient the breathing techniques, the use of the incentive spirometer. We're gonna pretend that this is the incentive spirometer. And there's a ball inside and you have to blow. And that ball has to go up to a certain number.
Okay.
And what it is, you will inhale and then inflate your lungs. So fluid won't build up around your lungs, causing pneumonia.
Okay.
And so you also learn to do the cough and deep breathing. You take deep breaths and breathe out. And breathe out. So you'll know when those when the doctor come in, he'll make sure everything is fine. We'll keep all this documented. And the doctor will be in with you shortly. Do you have any questions for me?
No, ma'am.
Okay. Any questions for the doctor? Then he'll be in shortly. I'll let him know your status.
Okay.
I'll leave that there. Your call light is within reach.
Yes, ma'am.
And we'll be back with you shortly, okay?
Okay.
All righty. You have a nice day, sir.
You too, Miss Monica.